The intersex community is not the one that generally requires to be part of the transgender ideology. It's not the community that needs sex reassignment surgery. So, what is at the root cause of gender dysphoria? What is the root cause that drives transgenderism if the intersex community, which is real, has to be excluded from that circle? Well, stay tuned to find out. Hey everyone, welcome back to another episode of SAFT Podcast. We are now in the triple digits. Thank you for joining along for all of these episodes, and I hope the last one was pretty interesting for all of you to see as well. It was definitely exciting for us to have made possible. And now we are stepping into episode 101, and this is an episode and a guest I've been really looking forward to. We're going to talk about transgenderism in Indian context. Now, this is a very complex topic, and so I've been wanting to get this guest onto the podcast. So I'm so happy to bring on Dr. Alan John to SAFT Podcast. Alan, welcome to SAFT Podcast.
Hey, Jacob. Thank you for having me. It's a real honor to be here.
So Alan is not a guest to SAFT. Alan is one of the speaking team members at SAFT. But I've known Alan long back since our youth ministry days in UA itself, when we were in our high school and we were part of ICPF as student leaders with the camps and all. And then even after that, we've stayed in touch with our mutual interest in apologetics. So Alan and I, we worked together on so many other ministries. We are part of SAFT. We are part of Reasonable Faith as well. We are part of Grace Cells. We have shared stage and spoken together and ministered together. So Alan is not at all a guest to me or to anyone at SAFT, but this is the first time that we are having you on SAFT podcast. So Alan, we're going to talk about transgenderism, right? And you are a medical doctor. So was that the reason that you found a passion to speak into this topic very authoritatively, because now you've been our go-to guy when we come to this topic? Or did you also have an inclination apart from your medical training to address this topic?
Yeah, so like many people ask me why I care about these issues. So as a doctor, I care because these are not just abstract debates, right? It's
Hmm.
not just about policies. It's not about politics. They affect real people's lives, health, and futures. I have seen myself, young people confused, distressed, even pressured into decisions about their bodies without being given full information about the long-term risks. So I feel it's my responsibility to bring evidence-based clarity into a space often clouded by ideology and politics. So also as a Christian, I believe every human being is made in the image of God and deserves compassion, dignity, and respect. So like my faith motivates me to hold together both compassion and clarity in these issues.
Wow, that's so well put. And clarity in this issue is really hard to get hold of, because
Yeah.
it's very political, it's very controversial, it's very technical as well. For example, when we
Mm.
talk about same-sex marriage, the technicality sort of dwindles down and comes into forefront when we talk about the legal side of what is a marriage and all of that. Like, that's when for a
Mm.
common person it
Yeah.
gets technical. But with transgenderism, from the get-go, it's technical. If you talk about the philosophy
Mm.
of a soul, a person, the feelings, the biological side, there's so lot to cover. So we're going to try and walk you through the audience to how you can understand this. Now, you may be a Christian who's convinced that this is an ideology to be pushed back and that it is harming people, or you may be a person who thinks that this has to be affirmed. So we hope that you would listen with open hearts and open minds and weigh what we say. So um, the first thing I want to bring up is that a lot of the news that we hear on transgenderism or transgender
Mm.
ideology often comes from the West.
Yeah.
Obviously, we're going to speak about what's happening in the West as well.
Mm.
And it's a big hot button issue there. And there's transgenderism movement rights and all of that. In India, why do you think this is an important topic to be addressed? Why do you think we as Indians, and we as average Indians or average Christian
Mm.
Indians, or however we want to categorize it, why do you think we should get into this dialogue right now?
Yeah, it's a good question. It's very important. I guess in India, we are at a crossroads. For the West, it took decades for them to get where they are now. But
Hmm.
we are trying to do it in India in about 5 years. Like the Western waves are coming so fast due to the advent of social media, and so For example, Kerala is offering free sex change surgeries, and pride parades are there in every metros. And even in schools, schools are quietly adding gender identity lessons, all while half of our villages don't have proper toilets. So if we don't address this now, we'll be importing Western problems to India, like without proper debates and safeguards.
Well, I mean, I had no idea that we have these topics coming up in schools. Is that
Hmm.
coming up as part of what, CBSE, ICC, or Kerala syllabus?
Yeah. So like I heard that last year a CBSE school in Cochin, like they did a gender identity session like on pronouns and everything to seventh graders, and that's just crazy, man. And like also there was a school in Delhi who did a training session, training to teachers to like train them to or like teach students on gender identity, gender pronouns, and all those like policy issues. So it's very real. It's happening in our schools right now, not only in the West, in India as well.
Yeah. I mean, this is not. I mean, obviously, for those who are away from that school background or from
Mm,
Delhi's vicinities would find it very strange. Like I am finding it strange. Um,
mm,
right. So, like you said, this is coming off of the West. Right. A lot of these global trends,
mm,
they start off in the West, they develop, they take form, and then they get exported to the other parts of the world.
mm,
Um, but in the West, we are seeing a significant shift. Like now we have come to a stage where we can't say that the Western world is wholeheartedly affirming or
mm.
putting forward
Yeah,
this, right. We've seen the CAS review come out of the UK, and we've seen
yeah,
recently the report released by the Department of Health from the UK, from the US as well, calling
yeah.
to question and challenging the ideology of affirming gender for young people and sex transition and all of that. Can you give, other than that, what is the other transition or other change, other evolution that we're seeing with regards to this
Mm.
approach to this identity or acceptance of this identity, of this ideology in the West?
Yeah, so we can't overlook the effect of the new US administration, the
Yeah.
Trump administration being in the White House. So the ripple effect is real. You may not agree with their policies or like
Mm.
their tariffs, but I'm not talking about that. The new US administration is pushing for reductions in gender affirming care for especially for minors. So suggesting more reliance on therapy rather than medical transition for youth. So such major policy shifts in the US tend to have ripple effects globally because being that a great nation, like socially in media and often in how platforms like Meta, like one of the biggest companies like in the world, adjust according to such political winds. So Trump signing that executive order titled "Protecting Children from Chemical and Surgical Mutilation," so that was just amazing. Praise God for that. So it shows a wide policy shift, and even the UK, like after the new US administration, that waves have been going to the UK as well. So last day, I think it was like 3 4 days back, I saw Meta removed trans and non-binary themes from Messenger and ended some DEI programs and changed moderation rules. So it's pretty ironical because like a couple of years back when I used to start my sessions on gender ideology, LGBTQ, I used to start with like the example like in 2015, Meta started their uh, this they when they got into this area, like there were like about 80 or 100 pronouns or like sex, like in the place of gender we could use like that spectrum of choices, but like now slowly that is changing, like now we are coming back to the common sense era. So that's great, like as part of policy shift, and that ripple effect obviously it will come to the east, to India as well, I believe. That's our hope.
Yeah, and I was when you said about you having taken talks before, I remember you would start
Hmm.
off your talks, you would show the emoji of a man
Yeah,
with a
yeah.
pregnant belly, and you would ask the crowd, "Do you think this is a guy with a dad bod?" I think those emojis are also gonna go the wrong
Yeah,
way. Uh,
yeah.
but then again, with these corporates, because they
Hmm.
succumb to the political whim,
Hmm.
there's, I mean, we don't know what they're going to do when the next administration comes in. If it's a
Yeah.
a left administration coming in, we don't know what's going to look like. Or if it's the America Party, Musk's, that's
Yeah.
going to come to power in the next election. I mean, we don't know how how that's going
Hmm.
to pan out. But it's good that the current administration is pushing back, cutting funding for gender affirming surgery and all of that. And just today, I saw I saw a Instagram post. I didn't get to look deeply into it. It was a congressman in the U.S. advancing
Mm.
a bill, an act called Chloe something
Yeah,
Act,
yeah,
specifically drawn off of the life of a detransitioner. And hopefully, we'll get to
yeah,
talk about some detransitioning
yeah,
as well. So this is a wave that is spreading far and wide. Okay,
yeah,
so we've talked about the West. Now, coming specifically with regards to India.
mm,
Um, do you think there is a sort of a linkage or an interplay, or maybe a shield or a resistance, whatever?
mm,
That's what I want to hear from you
yeah,
when we look at Hinduism and transgenderism, because in
mm,
India we see um, along the political lines we'll see I've seen some Hindus speak very
mm,
in favor of transgenderism, and I've seen
okay,
some other Hindus speak against transgenderism,
yeah,
saying that
yeah,
this is not part of the culture and all of that. Uh,
yeah.
what do we see when we look back at history?
Yeah, so I don't want to generalize, as you said, like
Hmm.
there may be Hindus who are against this kind of ideologies and holding on to very traditional view of marriage, family, and everything. So we're talking about like particular incidents. For example, in Kerala, we have the Cotton Kulangara Devi temple, where men
Hmm.
dress up as women to receive blessings from the deity. And in Karimnagar, there's a temple where trans-identifying individuals symbolically marry Lord Shiva. So, as I said, these aren't just fringe examples. So they are part of mainstream cultural and religious life in India. So, from a Christian perspective, I want to be very respectful here. I'm not mocking the sincerity of the people involved. Many who go to
Hmm.
such rituals are searching for acceptance, healing, for identity, for blessings. So, and that human longing is very real, and I
Yeah.
understand that. But we have to recognize is like when men cross dress as part of worship, or like when marriage to a deity is performed, it is not simply a cultural curiosity. It's part
Hmm.
of a deeper spiritual situation there. The Bible tells us that there is a war not against flesh and blood, but against powers and principalities. Ephesians 6:12. In other words, there are spiritual realities at work that distort God's design, good design for humanity, gender and marriage. God created us male and female. And in his image, as we see in Genesis 1:27, marriage was instituted by God himself as a covenant between man and woman, reflecting Christ and the church. So when alternate rituals imitate or distort those realities, they're not harmless. They redirect human longing away from the creator towards something that can never satisfy.
Yeah, yeah. I
Yeah,
mean, and that's a sobering reminder for us, because whenever we see this dialogue on transgenderism come up
yeah,
on social media or elsewhere, we see a
mm,
lot of time people attack those who are undergoing it.
yeah,
And
yeah, yeah,
especially as a Christian, when you do that, you're forgetting the verse that you just cited. Like the resistance or the opposition to it is not to the person per se. Like we are not,
yeah, yeah.
it's not coming out of hatred against that person or wanting to see them live or anything,
Yeah, yeah,
or wanting to wish harm upon them. It's
mm,
the resistance that we have is against the ideology that is
mm.
holding them captive. And
I
that's
understand.
precisely what we want to navigate. And it's a tricky line to navigate. Like when someone
Yeah,
hears it,
yeah,
looks like, no,
yeah,
you're speaking against me because that's my identity. And that's
yeah,
certainly an area where we have to speak with compassion and clarity. We have to put the
mm,
effort, and hopefully the
mm.
person on the other side would be willing to listen as well.
Yeah, yeah, yeah. So
But
like when we talk about gender ideology, also like one thing along that line, like
hmm,
it's not just a neutral scientific debate. For example, like let me say about its origins. It reveals
hmm,
something even darker. Like take the story of John Money, the
yeah,
psychologist at John Hopkins, like in 1960s, who pioneered in sex reassignment surgeries. So he built his theories on a tragic experiment, the Raymer twins. Like you can Google it up. I'm not going into the details, the entire story. So like Money convinced the parents to raise one of the child who lost his male genitalia in a botched circumcision, claiming gender is just a nurture, not biology. So he forced the children into disturbing therapy sessions to reinforce his ideology. So the for a while, the academic world celebrated it as a proof that gender is fluid, but the truth is, David never accepted the female identity and reverted to
hmm,
living as a man and later died by suicide. So, this entire ideology, the origin of it lies on like a tragic failed experiment. It was rather abusive. Like those children were even sexually abused by John Money, and that's just a dark history to this ideology. So when I said like about the spiritual battle, like it's real. So it's very dark. The history is dark. The foundation is dark. It's evil, I would say. Like I mean the origins. So at the same time, as we are saying, like we are talking about the ideology and not people. Like we don't want to talk against these people. They are actually hurting. They are having lots of mental struggles, mental distress. We accept that. We have to be compassionate, but we are talking about, yeah, these ideologies.
Yeah, exactly. I mean, that is
Yeah.
a very dark chapter
Mm,
for whole transgender ideologies
yeah.
base to see what drove it.
Mm,
Um, and you actually touched upon one of the point that I wanted to move on
mm,
forward and ask you with. It's a um it's a 4-word sentence that's very easy to answer, but has shook up the world the last couple of years. What
yeah.
is a woman? Like what do we mean by these identities? Like the whole the whole
Mm,
question behind it was, is
mm,
gender a social construct, something that society has created, or is there
yeah.
a real, true, objective nature to it? And
Mm,
again, it's going to be there's a lot to cover, but we have constraint of time, so I know you're going
mm.
to try and touch upon some other topics as well. So I'm going to give you the full go ahead to ram into it.
Yeah. So before I think we go into that area, I would like to lay some more context because primarily I think our audience is Indian. So I just wanted to lay a bit more foundation and context to what's happening in India right now, if that's okay with you.
Yeah, go ahead.
Yeah, so in 2018, we saw the decriminalization of Article 377, right? Like, so
Hmm.
that was a big moment. It basically said that consenting homosexual behavior would no longer be treated as a criminal offense. And many people confuse that with same-sex marriage, but actually they are very different issues. 377 was about private choice, but marriage is about redefining a public institution for everyone. So also, like fast forward to 2023, we saw the Supreme Court of India made it very clear that same-sex marriage is not recognized under Indian law. So that decision told us uh, two things. First, the court sees marriage as a deeply social and cultural institution, not something to be redefined lightly. Second, the push for same-sex marriage in India is very real, and I think and I hope like it will keep coming back. And there was a Transgender Persons Act that was launched in 2019. And then, of course, our home state, Kerala, is
Hmm.
often celebrated as India's most progressive states on these issues. We were the first to introduce a transgender policy in 2015. We have state-supported gender surgeries, a transgender justice board, and even something called Gender Park, a government-funded space for research, policy, and advocacy. So so, like in short, India is at crossroads. Like as I said earlier, decriminalization has happened. Same-sex marriage is being pushed, but not yet recognized. Transgender identity has legal protection. Let me be clear about one thing. Like people might like misunderstand us there. I'm not here to make a big issue about the decriminalization of homosexuals act
Hmm.
under 377. So what two consenting adults choose to do in private, I think that's their decision. And as a doctor and as a Christian, while I may not agree with the morality of it, well, I don't want to address that now. But the moment we move from private choices to public institutions, that's a completely different
Yeah.
conversation. Like legalizing same-sex marriage is not just about two people loving each other; it's about redefining marriage itself. And marriage is not just a private contract, right? It's the bedrock of society, and it's the foundation of family. Yeah.
Yeah, and you can go ahead into the gender construct social part. Yeah.
Yeah, so like people often ask like is gender just a social construct? Like so my answer would be like gender is socially shaped,
Hmm.
but it's not merely a social construct. Like from birth, boys and girls show natural sex-based differences in behavior and preferences. That's been documented across cultures, not just in India or not just in the US, like across cultures, like among the tribal people, like everywhere, like even in the Amazon rainforest, like that's the universal truth. So the reason every society in history has gendered social structures is because they are tied to something deeper, our biology and our human nature. Of course, culture influences how masculinity and femininity are expressed, like whether in
Mm,
clothing, like whether maybe culture will tell you like whether men must wear dhotis or like kurtas or like jeans, like,
yeah.
but culture itself rests on a biological foundation, right? Like it doesn't decide whether men can get pregnant. That's biology. That's not culturally shaped idea. So here's an important point. Your ability to fit in with others of your gender, say being less sporty as a boy
Mm,
or less nurturing as a girl, doesn't determine your gender. So gender isn't about your performance, it's about who you are biologically. And a big confusion today is mixing up gender and temperament, as Jordan Peterson says.
mm,
Temperaments vary widely between individuals, like, and yes, they can look like a spectrum. For example, some kids are naturally more active,
mm,
some are more quiet, and some are more sensitive, like, maybe like to your mind, one of your friends like image might come, like when you say some are sensitive. Yeah, that's just natural. Like research shows that maybe 1 in 10 boys might lean towards traits that on average are more common in girls, and
mm.
that's completely normal. Having a sensitive temperament doesn't suddenly make a boy a girl, any more than an athletic girl becomes a boy, right? Like, so temperament is about personality differences, gender is about biological reality, and we shouldn't collapse those two. Yeah.
Yeah, and speaking about collapsing those two,
Hmm.
what about the word sex? How
Hmm.
how are we
Yeah.
to see that?
Yeah, that's a great place to start. I mean, that's a good question. Like, so when we say sex, we are talking about biology. Like, it's rooted in something very
Hmm.
concrete, how our bodies are organized to reproduce. Uh, there are only two gametes, as you may
Hmm.
all know, like just basic like school level biology, like sperm and egg. That means two sexes, male and female. So male bodies are structured to produce smaller gametes, sperm, and female bodies are structured to produce larger gametes, eggs. So that's what makes the division clear. So sex is a binary, it's not a spectrum of endless options. Like it's a binary reality built into our biology. So like I often say like from cucumbers to humans, like you look at all the entire living organisms. So there are like sex is binary because the reason is there is a larger gamete and a smaller gamete that comes to reproduce and to procreate. So that's the foundation of sex. And many people like confuse sex and gender, and I understand the modern usage of gender is different. I mean, historically the word didn't even mean what we think of today. Like for example, gender, it was mainly a linguistic or like a term used like in grammar, like where words in some languages are masculine, feminine, or neutral. So
Hmm. Hmm.
gender was such a term. So when people did use the word gender about humans, it basically meant the same thing as sex. Like for example, like when we fill up our forms in some government office, uh, either it might be sex written there or it might be gender. We didn't
Hmm.
have any confusion. Like in place of gender, like we write either male or female. So it didn't matter, right? Like so
Yeah.
the roots of the word tell the story. Like it comes
Hmm.
from the root word gen, the same root that gives us other words like generate or generation. In other words, it's
Hmm.
directly tied to reproduction, like offspring and family. So the idea that sex and gender are completely separate concepts, that's a pretty like modern invention.
Hmm. Right. Right.
Hmm.
Now I'm gonna pick up some points that you said, and
Hmm.
hopefully we can try and stick within the time as well because I mean, there's a lot for us to cover. So
Yeah.
we're gonna give our best shot. You talked about from cucumber to humans. We see this dichotomy there. Now,
Yeah.
obviously, people would bring up and say, well, there are animals that are able to reproduce on their own, or do all sort of stuff that normally humans can't. Where
Yeah.
there is no dichotomy there. How would you look at that, and does that undo the case that you were making of dichotomy being present in nature?
Not really. That's what I said. Like in all animals, whether there are two animals coming together or it's within an animal itself. Like for example,
Mm,
I think earthworms or maybe cockroach. I don't. I might be wrong here. Like I mean, earthworms. I think. So the bigger gamete and the smaller gamete are present within that animal itself. So it's about
mm,
those gamete sizes. So there are only two gamete categories or gamete sizes. So that's the foundation of like
yeah.
sex. When we say like sex is binary, even within those animals, these two gametes come together to recreate. There is no third gamete. There isn't a
Mm,
third
mm,
size.
mm.
Like so that's the foundation.
Yeah, oh, that's a
Yeah.
good clarification.
Yeah.
Okay, so you said about this binary being there, male, female,
Yeah.
this gender binary. Um, and so immediately the question that would come to people's mind is, well, what is this category called intersex? Is there a place where this overlaps or gets confused
Mhm.
or mixed up? Um,
Yeah.
so
Mhm.
so can you speak into that?
Yeah, sure. So I think it's a very important topic, not especially like not only for lay people, I would say, like even many medicals or like medically relevant people, like they would confuse this. So intersex is a medical term, not an identity. It's a very crucial distinction to make. It's an umbrella label for a small group of rare conditions where a baby is born with, I would say, like a typical development of sex characteristics, like chromosomes or hormones or anatomy that don't line up in the typical way. So these in medical literature, it's called not as intersex, rather as disorders of sex development, DSD.
Mm,
So, but here is the key: intersex doesn't mean there's a third sex. These
mm,
conditions still occur within the framework of male and female biology. Like they are extremely rare, like less than 0.02% of births, but like they occur within the binary, within the dichotomy itself. There are differences or like disorders happening within the binary law. So like there are intersex conditions occurring to males, and there are intersex conditions like occur to females. For example, like there's a syndrome called Klinefelter syndrome. That's when a male has an extra X chromosome. Instead of XY, there will be XXY. So these are still
mm,
males,
mm,
but
mm,
because of chromosomal differences and the disorder or difference in the sex development that occurs within the womb, so they may develop some female-like characteristics, like maybe breast tissue or less body hair. That doesn't make them female. So it
mm,
it
mm,
it definitely doesn't create a third sex. So then there is an intersex condition called Turner syndrome. So this occurs only in females. Like there can't be a
mm,
Turner within the male sex category. So this occurs only in females. When they have just one X chromosome, these girls may have shorter stature, infertility, and health challenges. They might have a flat chest, like, but they're still biologically female. And if I recall correct, there was a quote like I used to use in my sessions uh, from the Intersex Society of America. They used to say like they wanted to be treated as males or females, not as a third sex. Even
mm,
like the
mm,
people suffering these conditions or going through these syndromes, they are the ones saying that, not me. So I want to clarify that intersex condition is not same as transgenderism. It's not a psychological issue. It's not a psychiatric or mental health issue. Rather, it's a actual physical condition. Like there is a disorder in sex development, and sometimes activists try to use intersex as a proof that
yeah.
sex is a spectrum. Like no way. But that's like saying because some people are colorblind, like colors don't exist. It doesn't
Mm,
follow. Intersex is a medical challenge, not a new gender category. uh, so
mm,
like
yeah.
so like just a bit more about this, because this is very important and a crucial
Mm,
distinction to make. Most of the people, like Christians, trans activists, even people from the medical community, misunderstand this. So you'll often see the I for intersex added to the LGBTQIA acronym, right? So, but honestly, it doesn't really belong there. As I said,
Hmm.
like multiple times, like intersex is a medical condition, not an identity. Most people with intersex conditions don't experience gender confusion at all, like or dysphoria at all. So, putting intersex into that acronym is misleading, and it takes a physical medical condition and it uses it to justify an identity issue, and in some cases, like mental health problems. So that's unfair to people with intersex condition, and it's not good reasoning. It feels more politically motivated than like being medically accurate.
Wow. Yeah. I mean, the point that you said that it's not a it's not a uh, identity issue, but it's a medical
Mm.
physical condition, and ergo it's not
Yeah.
part of the whole identity dialogue. Then obviously leads us to ask, when we talk about people who identify as transgender, um,
Mm.
is it do we see a pure lack of this physiological, physical, medical condition being present, and is it just a mere confusion? Is it in the sense that when someone comes up with gender dysphoria, and I want you to just break down what that means, but after that,
Mm.
when someone undergoes gender dysphoria, is it
Mm.
generally the case that they have it despite the lack of a confusing physical state, or is it because they go through that in some sense because they find some sort of difficulty to come to terms with their body, like where
Mm.
there's a hormonal
Right.
change and they find that confusing, like so is there a presence or is there a deficiency of those physical manifestations of what they think in their identity, in their hormones and chromosomes? Yeah, but maybe you can break down the term gender dysphoria and then you
Yeah.
can go
Mm.
into it. Yeah.
Yeah, that's a good place to start. So, gender dysphoria, the condition of feeling that your gender is opposite to your biological
Hmm.
sex, in simple terms, like it's a profound and often debilitating sense of alienation from one's bodily sex, like an incongruence. So it's a recognized mental health condition, and where someone experiences distress because their biological sex and their internal sense of gender don't match. And it's different from being gender non-conforming. Like for
Hmm.
example, like that just means you don't fit stereotypes, right? A
Hmm.
tomboy
Hmm.
girl is not automatically dysphoric. And no,
Hmm.
and no, there is no blood test for gender dysphoria. As I said, it's not a physical condition, for example, but there may be repercussions, like or like as you assume if you, for example, if a male like lives like a woman later in his life, maybe like if you test for certain hormones like testosterone, it will be low. It will be like on the lower sides, but that's not diagnostic. It's there is no physical test, like no brain MRI or blood test that you can do for it. As I said, it's primarily a psychological or mental health condition and not a physical condition. As you rightly contrasted it with intersex condition, intersex conditions, like it's primarily physical, like it's in your cells, it's in your reproductive anatomy. Like most of those intersex people, they are like infertile, they cannot reproduce because their, for example, internal syndrome, the ovaries won't be functioning well, so the bigger gametes won't be formed, and she cannot reproduce, like she's not fertile for it. But when you take a person suffering with gender dysphoria, or when you take a transgender, they have perfectly like healthy and functioning like reproductive organs, like they don't have any problem with fertility. So it's not a physical condition, right? As I said, and it's primarily a dysphoria. Dysphoria means like intense mental distress, like kind of a delusion. So that's a psychiatric condition.
Hmm. Yeah, because it comes off as very shocking, right? To hear that intersex people are the ones who are not undergoing the confusion. Um,
Mhm.
but
Yeah.
it's those who don't have, because evidently we would, even when we grow up, we are always told that puberty is a period that's very confusing. Well, why is puberty a period that's confusing? Because you're seeing these physical changes in your body.
Mhm.
So
Yeah.
I was just thinking about, um, first of all, it's going to be very difficult for us to convey as well, to say to someone that,
Mhm.
hey, this is a big misunderstanding. And I know that that's only so much we can make it convincing to
Mhm.
a listener as well. But and this would be a very difficult topic to try and toss it your way to tackle. But why do you think gender dysphoria is then so much on the rise if intersex is not the causal factor, or if that community is an extreme minority? Why do you think gender dysphoria or this
Mm.
whole dialogue of transgenderism is so much on the rise?
Yeah, so talking about the causes of gender dysphoria, in science today says gender dysphoria doesn't come from a single cause. So
Hmm.
there's no trans gene or like one biological switch. It's what we call multifactorial causation model. Some people may have a biological predisposition like temperament or sensitivity, as we discussed earlier. Some people will be naturally like more sensitive, and when it is coupled with other issues like which I'm going to talk now, so the causal factors would be like psychological. There are like family dynamics and social influences like play a massive role. Uh, Let me give a few real life examples. Dr. Kenneth Zucker, like who ran the gender identity clinic in Toronto, Canada, documented how childhood experiences can shape dysphoria. He had boys who wanted to be girls, not because they were born that way,
Hmm.
but because of trauma, rejection, or family dynamics. For example, some boys, as we said before, like were deeply sensitive, cried easily, and didn't fit the rough and tumble like male stereotype. Instead of being reassured that they could still be boys, they started thinking, maybe I should have been a girl. And Dr. Kenneth Zucker helped them realize it's okay to be a gentle boy. That doesn't make you a girl. And Dr. Ryan Anderson also reports testimonies of
Hmm.
men who transitioned and later regretted it. Many traced their dysphoria back to sexual abuse in childhood or feelings of inferiority complex, like compared to other boys. One man described being bullied so badly that he developed an inferiority complex, like thinking life would be easier as a girl because, as we know, like boys get bullied more often, and like
Yeah.
even boys tend to bully others often. Like so, another said he was sexually abused by a family member, and that trauma made him hate his male body, and later he transitioned to female. So, and there are like cultural conditioning, environmental conditioning as well, like as a causal factor. Take the Malayalam movie, like for example, Chandput. The plot
Hmm.
shows Dileep's character raised as a girl by his grandmother because she desperately wanted a granddaughter. He grew up in a female clothing, learning feminine mannerisms. And as an adult, he struggled with identity confusion. That's not just fiction. Psychiatrists have reported similar real life cases. Like there are lots of real life cases like that where grandparents or parents dress a boy as a girl, and over time it creates confusion and even
Hmm.
dysphoria. So the picture we get is this: gender dysphoria is often a symptom of deeper issues like trauma, family dynamics, abuse, social pressures, or like cultural reinforcement, not a fixed biological entity. If we rush to affirm it without asking the root cause or like the why question, we risk missing the like root causes and locking kids into an identity that may not actually heal their pain. And as you were rightly pointing out, now there is this rise of gender dysphoria, especially in colleges. And there was an interesting study that is done by Dr. Lisa Littman, and she coined the term, labeled it as rapid onset gender dysphoria, ROGD. What she did was like she conducted a survey uh, in the she actually surveyed the parents of high school kids, like teenagers, and what she found out was there was a rise of gender dysphoria cases, not like as these gender ideologues, not as they advocate. These people weren't born that way. They didn't have any sort of confusion like up until their teenage
Hmm. Hmm.
age. And suddenly, like these people, like spontaneously, like suddenly, all of a sudden, they started identifying as females. These teenagers, especially girls, like who are like 15, 16, 17 years of age, they suddenly started identifying as the opposite sex. So she traced back the causes, like especially she surveyed the parents, right? Like so she traced back the causes to like social media and how peer influences like was a big deal. Like people like started going along with that trend, like that social contagion. She labeled the term social contagion, like it was spreading through like TikTok and Instagram and everything. Like they had their own Discord communities and like online like networks. Like once you enter into that, it's highly likely that you'll be trapped there and you will get along that wave. So those are some of the causes I wanted to discuss.
Wow. I mean, um, the current state of the whole dialogue on this topic is such that
Mm,
we can't speak out these as the real causes because it is such a
mm.
political issue. It has become
Yeah.
so much farther away from being a medical issue, or a
Mm,
psychological issue, if you want to categorize in that perspective.
yeah.
It has become a political issue. So anyone who
Mm,
speaks out and says, okay, there are other underlying causes, is now would be seen as a transphobe. I mean,
yeah.
Charlie Kirk was seen as a homophobe and a transphobe. So I don't think that gives us any slack or gives us any hope of not being tagged that way. Um,
Mm,
we've come to the crux of it to realize, okay, what is gender dysphoria? What are the causes?
mm,
Um, and there is, as you laid out, these underlying factors and events and experiences that give form to these confusions.
mm,
Now, for such a person, is transitioning ever a real solution? Right? And that's where the
mm.
whole debate is around pure in the medical field, right? With the
Yeah.
CAS
Yeah.
review and with the US review, all of that's come out.
Mm,
It's a question about how effective is it. Now, obviously, the CAS review said that. Um, I think it's the NPR that I was reading an article by the NPR on it, and they
yeah.
phrased it as the CAS review said the advantages of gender transition surgeries are overstated. Now, that may be a
Yeah.
very politically neutral way to
Mm,
phrase it in such a way,
yeah.
but from a medical perspective, when you look at it, for such a person who's undergoing confusion, what is the best, better, or true solution? Enabling them to transition into another gender, or
Mm.
to help them deal with those confusion?
Yeah, so like there's another important question, like before we address what you asked, like, is it true most children grow out of gender dysphoria if left alone? That's a very
Hmm.
profound question, and there was a data uh, actually addressing this particular question, and it stated that yes, like 80 to 95% of kids with gender dysphoria desist by adulthood, if not socially or medically transitioned. So
Wow.
that's why early medical intervention can lock in what might have resolved naturally. So it could be a
Hmm.
temporary, like confused phase, and we shouldn't intervene in that temporary phase, making like permanent changes, which cannot be like reversed later on. So, and about
Hmm.
like puberty blockers and cross-sex hormones, like they carry lots of risk. Like blockers can stunt growth, affect brain development and delay sexual maturity. Like cross-sex hormones can cause infertility, heart issues, like cardiac issues, and irreversible body changes. And we are doing this to 13, 14-year olds, and whose biggest regret last year was their haircut. Like we are man,
Hmm.
we are bringing these permanent changes to such kids. Like, and as you ask, like, can sex reassignment surgery change our sex, like our biological sex? Let me give a more context to what like sex reassignment surgery means. Like, for example, for a trans woman who wants to transition, who's a biological male who wants to transition female, like that usually means like removing testes, doing pinectomy, and creating female genitalia. For trans men, like a biological female who wants to transition to male, it might be like mastectomy or building the male genitalia. So here's the truth: these surgeries like often like advised as the treatment of choice. I was thinking like for almost all people going through gender dysphoria, or like even like socially transitioned people living as the opposite sex, their end goal, I think their ultimate purpose and like their goal is to reach this level, to attain like to gather finances and the funding and like do this
Hmm.
sex reassignment surgery. That's their end goal. They think that's going to resolve their issues. They think that's going to make them happy and satisfied. But here's the truth: These surgeries are just purely cosmetic surgeries. They just change how the body parts look, and it in no ways like change your biological sex. It's impossible to change your biological sex. Dr. Paul McCue, a leading psychiatrist, calls these surgeries as bad medicine, and he often tells doctors must be like dealing with the psychological issues rather than like attacking the physical or like the healthy reproductive parts of people suffering through gender dysphoria. And he says it's treating a mental health issue is cut by cutting healthy organs rather than helping the mind to heal. That's very bad medicine. You are actually harming the person, and you are creating irreversible changes, making that person permanently infertile. For example, for a male transitioning to female, once you remove his testes, there's no way he can reproduce ever again in his life. So that's
Hmm.
just healthy reproductive organs, functioning reproductive organs, not infertile, as I said, with the intersex condition. These are like functioning, healthy reproductive organs, and you are like permanently removing it just because of some psychological issues or mental distress. And it's not risk free. Removing reproductive organs makes someone permanently infertile, and most post-operative trans individuals report ongoing health problems. Like, I don't want to
Yeah.
get into the details of it, urinary incontinence and lower satisfaction with life than expected. So these surgeries might change appearance, but it doesn't change your sex, and it comes with real permanent consequences, and that's what we have to understand.
Yeah. And, and,
And
and
this
and
is
that's
yeah,
that. Yeah.
yeah,
Yeah. Go ahead.
and this is what like Kerala is like financially aiding. Like Kerala does have
Hmm.
a financial aid scheme via the social justice department. Like transgender person can apply for assistance up to 2 lakhs towards SR. So yeah, this aid definitely helped the transgender person financially. Another thing is like I could not find trustworthy evidence that there is any official state registry or like a system built to follow up these patients to see how many have complications, regrets, or how their psychological health fared over years. So this matters. If the government is helping people undergo irreversible surgeries or medical procedures without tracking outcomes, we won't know like whether these policies do more good than harm. We need not just assistance, but like accountability and responsibility. Yeah, so like we don't have the full picture yet, and
Yeah.
yet we are like doing interventions like and making like irreversible changes.
Yeah. And speaking about the full picture part, when it comes to long-term studies on the effects of
Mm.
puberty
Yeah.
blockers and reassignment surgeries on minors and adults, what is the status of the scientific research in that area in terms of long-term study?
Yeah, so studies are obviously mixed. Some report temporary relief, but long-term follow-up studies like Sweden's 30-year study show higher rates of suicide and psychiatric issues than the general population, even in supportive environment. Like we are talking about like countries like Sweden, Argentina. So these are supportive, accepting environments. And many people ask like, is the high suicide rate among transgender folks just from discrimination, or like are there deeper issues? So the evidence is like both. Yeah, obviously there can be like discrimination, rejection, violence, sexual abuse, and lack of support. That's there. I'm not negating that fact, but even in more accepting places, like the rates remain high, which suggests there are internal struggles like mental health issues, identity distress, and maybe trauma. Like down here in Kerala, like there are news reports of rising suicides like among transgender person. One case was after a problematic SRS surgery, often due to and others like due to social rejection, yeah, mental health struggles. Yeah, so yes, discrimination is a very real factor, but there are also like deeper causes: internal distress, identity confusion, and maybe trauma. And these issues are not resolved by the cosmetic surgery that you are undergoing. That's the important point to understand. So these cosmetic surgery, that's what the data shows, like at least. these cosmetic surgeries are not resolving your like identity confusion or like your mental distress or root cause like inferiority complex or like your past history of sexual abuse. And the lack of access
Yeah.
to mental health care can be a reason like these people undergo suicide. But uh, it's that's why it's important. Like we need like a holistic approach, like counseling and honest help. So honest help are so important. Like we need to actually help these people, like not just because of some you get some brownie points as a governing party or something like. But it's not about affirming them. Like it's not about affirmation alone. We if you actually want to help these people, you have to like there should be like a pastoral care, like counseling help with like you have to try and find out the actual root causes, like what triggered it. We have to take the history of like probably like the childhood histories, like how that person was brought up, like is there any like triggering factors in his life. So that's very important. So we need
Yeah.
this holistic approach. And as I said, like SRS surgeries, like sex reassignment surgeries, are not going to help these mental health issues, as we see from the studies from Sweden and Argentina.
Yeah, yeah, and I want to get into what I feel is one of a very strong objection to our resistance to transgender surgeries and as such. But when you were talking about, I was just thinking when you laid out the real causes of dysphoria, um, it is never the cosmetic surgery part that's going to undo it. Like that was never a cause or an issue in the first place, right? We would expect that should be
Yeah.
the cause for a person with intersex, and that is a
Mm.
very clear and outright part telling us on how to deal with and what's wrong
Yeah.
with the current way of dealing with it. And as you were talking, as you were mentioning the issues that come about with these surgeries, a lot of people
Mm.
don't fully grasp. Like even externally speaking, we don't fully grasp what it's going to entail. So to bring up two examples, CB Chan, CB Matthew, who is the director of ICPF School of Apologetics and Reasoning, which is ICPF's dedicated apologetics team, which
Mm.
where again me and Alan are part on.
Mm.
CB Chan, in one of his talks, he was pointing to the fact that when a male undergoes surgery to become a woman, as you said, the genitals are removed and the female
Mm.
genitalia is reconstructed there. And he asked a simple
Mm.
question.
Mm.
He asked, "Do you think that genetic male is going to feel what a woman would feel even with that surgery?" And he said that
Mm.
whenever we have a wound in our body is always trying to close it up. And when people undergo the surgery, the effect that's happening on their body is causing their body to treat it as a wound, to try and close it up over and over again,
Mm.
and they go back
Mm.
for surgery, keep going back over and over, um, to put it bluntly, to cut it open and to keep it open. And that's a very painful image to
Yeah, man.
even for us to envision, to say that okay, this is the price that is paid,
Yeah.
for what? Because it's pushed upon them. It's said that this will solve everything for you, that this is
Mm.
the solution. Just raise fund, give big pharma and big uh,
Mm.
medical companies the money, and all of your problems will be solved. And even in India, we had this case of a transgender woman and a transgender man married and being a couple,
Mm.
and
Mm.
the transgender man bore the baby in the womb,
Mm.
and the roles were swapped and all of that. But the
Yeah.
transgender male was genetically female, had a
Mm.
mastectomy, had the breast removed. Um, well, the body was still going on the same role of a woman, and the transgender man was ending up lactating, which was extremely
Mm.
painful and deeply an issue biologically. So and that comes to the underlying point that Alan was saying, right? At the end of the day, if your
Mm.
biology is XY or
Mm.
XX, that's your biology. Your body, the hormones, everything is running from start to end in that whole format. And a
Mm.
cosmetic surgery is not going to solve it. It's even for me as someone with zero medical background, it tells me that
Mm.
that's a very gross misunderstanding of how our body works. Like every cell in our body is either male or female. And for us to rewire a biological man to
Mm.
be a biological woman, you will have to rewire every cell in their body, every bit of hormone in their
Mm.
body, to tell them that this is the wrong trajectory. You have to go in a completely different direction. Um, and the lack of, as you were saying, the lack of these studies and long-term effects on minors as well is very, very alarming. which is why there is
Mhm.
such a serious pushback, especially when it comes to minors. It's not because
Yeah.
we don't want to see people who are transgender living or anything of that sort. It's That's a very disturbing and dangerous and harmful place to
Yeah.
place someone who is very volatile and flexible in their emotions, and so much of change is going on in the body, to put in that trajectory.
Mhm.
And I feel very egregiously hurt about it when we see this pushed upon minors, and
Yeah.
on adults are there who are not given enough time for consultation, who are not given
Yeah.
enough time to rethink and all of that. And that's what I said, like where I see what could be a very strong objection to people like us speaking out against it. And I've heard it from um, a CSA friend of mine who was, he's active on social media, and he and I, we were talking about transgender priest coming into the
Mhm.
CSI CNA church settings. And he said, all right, I understand your point about gender dysphoria and all of that, but if a person who is a transgender, who's undergone the surgical reassignment surgery and all of that, sex reassignment surgery, and that
Mhm.
person comes up to me or you and they say, um, I feel happy in this body. This is what I want,
Yeah.
and I'm telling you very clearly, I am happy in this body. This is
Mhm.
what I want. This is what I want to keep getting. When they say that, right now we've talked about studies and in general, and talking about the whole field as a general, but when we come to a
Yeah.
specific individual stating that and telling you, no,
Yeah.
no, 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 it's not confusion, it's not personal issues, it's not personal experiences, I am telling you why I want to do this. It's because I want to change. I feel being in a different body. What would we as Christians first,
Mhm.
and also what would you as a Christian doctor who knows the science behind it, who knows the whole thing behind it, would say in response?
Yeah, that's a very profound question. I wasn't expecting that, but like, um, yeah, obviously, like, and when an adult comes and tells us like they want to undergo these surgeries, we can lay out the facts, we can lay out the medical side effects, consequences, and we can tell him we don't know the long-term picture. We can maybe like one of the most important practical tools which we can use in conversations. Yeah, what I believe is the story of detransitioners. Like
Mm,
I would probably like point them to like multiple stories, not just one or two, like maybe thousands, like tens and thousands of such stories. These are people like that person you are referring to, like who went through like similar situations. They undergo they like went through those like sex reassignment surgeries and like or permanent transitioning, and later in their life, like maybe down the line, after like 5 years or like 10 years or 15 years down the line, they regretted doing that, and like they detransition, like they like reversed and they came back to their original sex. So I would use those stories to that person, and especially the medical side effects. Like I didn't touch that point because it would be like, as you were saying, like Sibichan was saying, like that's very true. Like I didn't go through that because it would become a bit graphic and technically difficult to comprehend. Like for example, it's not, as I said, like this surgery is their end goal, ultimate goal. They think it's going to resolve their like
mm,
mental health issues, but it's not going to. And also the road after the surgery, like the recovery is not at all easy. It's not like one day you go to the operation theater, like get your genitalia like cosmetically changed, and it's like happy life ahead, like happy days from the next day. It's not at all that case. Like years, like after the sex reassignment surgery, these people go through like intense pain, and like for years, as I said, like urinary incontinence, they cannot like control the urge to urinate, like because of the musculature being like altered there, like to cosmetically create the genitalia of opposite sex. And for example, like when a male is transitioning to female, obviously when you create the female genital tract, and as we know, like anything like unnaturally created, our body
mm,
tries to heal. Our body tries to heal that and close that, and these people have to use like tampons and everything like permanently, like throughout their life, to keep that genital tract open. And it's not going to serve the reproductive function. Like for example, a healthy human adult female, like the female genital tract, serves a reproductive and like sexual functions. So that's not going to like function. The artificially created or cosmetically created trap
Yeah.
is not going to function in that way, and it's going to give you just pain and lots of side effects, lots of like struggle like physically and even mentally. And later if you want to detransition, you can't like reverse. It's not at all easy. You can't just reverse. So I would say like I will like lay down all these facts, all these stories about detransitioners, but in the end, like for a consenting like adult, like it's up to them. We can't force them into anything. Like it's up to them what they have to do with it. But that changes when it comes to minors and children. Like when like parents like take decisions, like woke parents or like liberals or like left-leaning people do this to like minors, like 12-year-old, 13-year-old, that's a whole another picture, man. Like you can't be doing that to them. Like they can't consent. They can't understand the long-term consequences. So it's whole another issue.
Yeah, yeah, and I know we're coming towards the end of the podcast, and there were a couple of stuff that we didn't address because we didn't have the time. So one was the question about eunuchs in the Bible. Now I'll drop a link in the description to a blog that we have on SAFT Apologetics blog, written by Charles Sir, who is a renowned psychologist, and he's given a three-part article breaking down the again dealing into some of these questions and also specifically addressing the topic of does the Bible affirm transgender ideology? Is
Mm,
the Bible speaking in favor of it when it speaks about the eunuch in the gospel?
mm,
So you can definitely take a look at that for more information. And on our Areopagus 2022 conference, we did a couple of years back. On the third day, we had Linda Saylor, who is an ordained
mm,
minister at the Assemblies of God Church, who came on to speak, and she was a deep transitioner. She went through this whole process. So Linda Saylor, again, I'll drop her session from the conference. She was speaking about how the gospel, how Trinity speaks into our idea of marriage and all of that. It's
mm.
a powerful session. Take a look at that and also check out her stories. But speaking about deep transitioners, Alan, I have two more questions to run by you. So, for someone to know more about deep transitioners or to find a real live example of a person who has gone through it in social media and through Daily Wire and all of these Instagram pages, they would come across some of these clips. But other than that, is there any name that you would bring up or anything that you want to bring up again that you've mentioned in the podcast so far?
Yeah, again, like as like we have time constraints, I'm not going into the stories. Like rather, I would just drop names. You can look it up. Like everyone listening must like look into Walt Hare. So he now runs a ministry called Walt Hare Ministry. So like you can just look up his story. Then there are like Kara Bell in UK, another detransitioner. So you could just like look it up. I'm not going to the depths as we said, like due to time constraints. So
Yeah.
can we address there was something else like I wanted to address in this
Yeah.
podcast. Like so there is a philosophical problem like when like people like say that they are born that way or like it's a very popular slogan that I feel like I'm in the wrong body. I just
Mm,
wanted to address that quickly. So that phrase, I feel like I'm in the wrong body, like sounds sympathetic at first, but it's actually a very strange claim. Like when you think about it, it assumes that your mind is always right and your body is wrong. But in most areas of medicine, like when the mind and body clash, we help the mind conform to reality. For example, you take anorexia, for example, like someone may feel they are overweight even though their body is undernourished. We don't affirm their feelings, right? Like we treat the mental distress and help them accept their body. For example, there's another condition called body dysmorphic disorder. Person may be convinced their nose is hideous or not good looking, or their skin is deformed, even if it's objectively fine. Again, we don't recommend unnecessary surgery to those people suffering with dysphorias, like these other dysphorias. We treat the underlying mental struggle, right? And there is another like interesting dysphoria called species dysphoria you might have seen in news or like Instagram post or something, like a rare condition where someone identifies as another species like a cat or a wolf or a dog. In those cases also, like medicine doesn't say okay, let's do a surgery to give you claws and a tail. Yeah, there are
yeah.
people doing that and that's big news, but generally, like as a treatment guideline, we don't do that. We recognize it as a psychiatric condition that needs compassion and therapy. Like, but yet when it comes to gender, suddenly the roles are flipped. If your mind says one thing and your body says another, we are told it's the body that must be cut, reshaped, and chemically altered and castrated. That's a very radical and I would say dangerous departure from how medicine normally works. And as I said, like that's a very modern idea as well. Honestly, it sounds
Yeah.
a lot like a old heresy, like Gnostic dualism that says the real me, I mean the mind, is separate from my body, and body is
Mm.
bad, and your spirit needs to escape it, and all those stuff. Like so, but both medicine and Christian anthropology, like in philosophy, and both medicine and Christian anthropology agree that we are embodied persons. My body isn't just something I have, it's part of who I am. And to be human is to be a unity of mind and body, not two disconnected parts. Like the old philosophers like Aquinas called this integral anthropology. Man is a rational animal. So there is
Mm.
rationality and animality. So that rational animal integration makes us human. Like that's who we are. Soul and body together, not just soul trapped in a body, like waiting for some sort of escape or liberation. So there are many views like hylomorphism, like Thomistic dualism, compositionalism, substance dualism. I don't want to go into the rabbit hole of like philosophy of human personhood, but just the basic conservative view we must understand, like as
Yeah.
opposing to something called Gnostic dualism or like neo-Gnostic dualism. So this matters morally too, because like if you define personhood only by mental functions, you end up excluding the unborn, like the disabled or the elderly with dementia. But if you see the person as an integrated whole body soul together, then dignity belongs to every human being, regardless of
Exactly.
their abilities. Yeah.
Yeah, yeah, and that's a spot on point. And even in the
Yeah.
What is a Woman documentary by Matt Walsh, there's a point where he talks to
Mm.
a transgender doctor, and he says, what if a person
Yeah.
says, I feel like an amputee, and I feel like a person without
Mm.
right
Yeah.
arm, and shall they take it off? And the transgender doctor said, that's cuckoo, like that's out of your mind to think that. It's ironic.
Yeah.
It's ironic that the doctor doesn't see how it flips on the other way as well. And now I'm coming to
Yeah.
the last bit, and we have covered a lot of technical points.
Mm.
And
Mm.
I'm going to give you 2 minutes to get to this, and try and answer it in 2 minutes. But and this is a very
Yeah.
practical point as well, right? If when someone says to
Yeah.
you, and I had a transgender classmate during my masters, when someone says to you, "Hey,
Okay.
you have to change the pronouns with which you address me," or you are invited to a
Mhm.
wedding of a transgender friend, right? When you have these
Okay.
practical personal things play out, what should be your response?
Mm.
Changing the pronoun use and being invited to a transgender friend's wedding.
Yeah, so like as Christians, we are called to show love to people, right? Like to keep the door of relationships open. But when it comes to weddings, our attendance is more than just presence. It's
Mm.
public witness. It's participation in affirming that union, right? Like so that's why I would often say like you can show love in many other ways, like phone calls, meals, friendship, like prayer, like but attending the ceremony itself crosses into affirming that something we cannot affirm. Like so now that doesn't mean we get harsh or like self-righteous. If you decline, do it gently, like say something like I value you and our relationship deeply, but I can't in good conscience celebrate this. I'd still love to meet up soon because you matter to me, like and catch up with that person like later on, like continue that relationship. That way you are holding on to truth and love together. So as I said, like Christian response has to be holistic. Philosophically, we affirm the truth that male and female are part of God's design. And ethically, the reason we don't affirm is that we want to guard children and families like from harm. And yeah, like theologically, we were talking about like how every person is made in God's image and needs the
Mm.
gospel. So we need to operate with courage and compassion in our workplaces and families and friendships. So and about the pronouns, like uh, I got a similar question like a couple of months back from someone working in a corporate and like in HR. Like, so here also we want to show respect and kindness. On the other hand, words matter. Pronouns aren't just polite labels. They carry truth claims about reality, right? Like, so as Christians, we believe God created us male and female. So to deny that, even without language, can feel like we are going against our conscience. So how do we navigate this? We'll have to aim for balance of like truth and grace. Yeah, again, you shouldn't mock or be harsh. Avoid like mockery, like making jokes about pronouns, or like
Yeah.
avoid cruelty, that's like, yeah. So some practical steps would be to use names generously, like
Yeah.
instead of pronouns, like refer to the person by their chosen name. It's courteous, like avoids unnecessary offense and sidesteps pronouns debates. Like, and also I would often say, like, don't make it the hill to die on every day.
Mhm.
Remember, your witness is more than just one word. It's the way you treat people consistently, like with dignity. And as you said, like if pressured directly, you may need to gently explain, like, I want to respect you as a person, but for me, pronouns carry a deeper meaning. I'd rather call you by name, especially in public. Like that's again, like it's a public witness, like others are listening to what you're affirming. So I can stay true to my conscience while still respecting you. But in private, if our greater goal is to bring that person to Christ and offer the gospel in order to maintain the relationship, I think like we may use that. But that's what I said. There is no general solution. All depends on like
Yeah.
particular scenarios, and there is no general solution. Pray for wisdom and discernment to handle each relationship and each situations.
Yeah, yeah, and that's the bottom line. Like, thank you for
Yeah,
putting that across. It's that
yeah,
when you want to step into that, after hearing this talk and getting all these points, and you want to step into the real world, your first
mm,
step must be a step of courageousness and boldness. Like,
yeah,
without that, even the practical points that are laid out would be
mm,
absolutely useless.
yeah,
So it starts off with a personal conviction, and I'm speaking to the Christians who are listening to this. It starts off with a personal conviction,
mm,
and that boldness that you take, which is
yeah,
then played out in these interactions and in these practical applications and all of that. And certainly that has been the voice that has been echoing around the world to speak courageously and boldly in the past 2 weeks since the assassination of Charlie Kirk. And he
yeah.
was a voice of being compassionate and bold, but also very courageous in the faith in the
Mm.
face of lies and deceit. And so
Yeah,
thank you, Alan, for coming.
he knew,
Yeah.
yeah, he knew where to draw lines. Like,
Yes.
and biblically, this is about like living like Daniel in Babylon, right? Like he worked faithfully in a pagan system, and he Daniel knew where to draw lines. For him, it
Yeah.
was about food offered to idols, but for us, it may be about language
Yeah.
that denies God's creation.
Absolutely. So thank
Yeah,
you, Alan, for breaking down the whole medical and the scientific aspect, and also for those wise reminders on how to live out boldly
yeah,
in this Babylon that we are in. Very frankly, to put it that
yeah,
way.
yeah,
Thank you for coming on, and we hope this was informative and helpful for you as well as our listeners. And stay connected. We'll tune in the next one.